Hi there, it's Justin Lubino with Senior Advisors, and we create this video each year to discuss the Part D of Medicare program, specifically how the different steps within Part D work, how the donut hole or coverage gap works, and if you reach catastrophic coverage, how does that work as well with Part D of Medicare. This has been one of our more popular videos in prior years, so I hope you find this information helpful and useful for you. So how does Part D of Medicare work? So Part D is the drug coverage. And in each state, there's approximately 25 different Part D drug plans available. And we have other videos out there that explain how we pick the most cost-effective Part D drug plan for each individual. But this video is explaining the framework for how Part D of Medicare works and how it changes from year to year. So this is for the 2023 plan year. So this slide explains some of the differences from 2022 going into 2023. So the different steps, the first step is the deductible. So these drug plans can have a deductible, okay? They don't all have a deductible, some are zero, but they do have a maximum that they can have for that deductible. And in 2022, it was $480. In 2023, that's going up to $505. Okay, so if your drug plan has a deductible, it generally only applies to those higher tier drugs. So if you have like a low cost tier 1 generic drug for cholesterol or blood pressure, those are generally covered regardless of the deductible. So you might have a $1 copay, $0 copay for those tier 1 drugs. But if you have a higher tier medication, that deductible would come into play. And so you'd have to meet that deductible before you'd get to a copay or coinsurance for that medication. So that's how that first step works. Most of these Part D plans, I'd say 80 to 90%, at least in 2022, they have a deductible, and it's generally the maximum deductible. Okay, so there are a few plans that don't have a deductible, but you have to pay a lot more in premium to get those zero deductible drug plans. The second step is the initial coverage level. Okay, and 85% of people are never going to get past this initial coverage level. Okay, you have to have very expensive medications to get past step 2. Basically, in 2022, the initial coverage level was $4,430 based on the retail cost of your drugs, and that's going up to $4,660 in 2023. Okay, so that's based on the retail cost of your drugs. So as long as your drugs cost less than that total cost for the year, you're just going to pay a copay or coinsurance for your medication. Okay, so it's going to feel similar to a employer health plan or under 65 individual where you go to pick up your medication every month and it's really the same cost, you know, $10, $40, $5, whatever that coinsurance or copay is while you're in that initial coverage level, okay? And again, 85% of people aren't going to have drugs that cost more than that. That's not as much, that's not the amount you're paying for your drugs, it's the total cost, total retail cost of your drugs that you're consuming for the year. So if you have very inexpensive drugs, you may want to skip the rest of the video or the next 5 minutes of the video and skip to the end, because we're going to get into some more complicated discussion with Part D of Medicare that really only applies to those folks that have very expensive medications. So if you do exceed that initial coverage level and you've got those expensive medications, you're going to fall into that step 3, which is called the coverage gap. It's also known as the donut hole with Part D of Medicare. And if you reach the coverage gap, you have to pay 25% the cost of the drugs, okay? So I'm going to give a brief example just to help illustrate this on the next slide. Actually, we're going to give a detailed example to illustrate this donut hole and how this all works together. So hopefully it'll make a little more sense once we look at the example. But you're going to be in that coverage gap if you, again, only if you have expensive drugs. Once you reach that coverage gap, you're going to be in that coverage gap until you reach a true out-of-pocket cost of $7,400 in 2023. Now, true out-of-pocket is not what it sounds like. True out-of-pocket includes everything you've spent for your medications, but it also includes the pharmaceutical discount for the medications while you're in that coverage gap or donut hole. Okay, so rather than get tied up in these definitions, because it's apples and oranges, right? It's retail cost to get into the donut hole, and then it's true out-of-pocket cost to get out into that step 4, which is catastrophic level. So rather they get caught up in those confusing definitions. If you have expensive medications, you're generally going to spend about $1,500 to get into the coverage gap, and probably another $1,500 or so to get out of the coverage gap into catastrophic coverage, okay? And again, we're going to show you a detailed example on the next slide of exactly how this all works. But just generally speaking, that's how it's going to work. If you do reach catastrophic coverage, it's there to protect you, so you're not stuck paying that 25% for the entire back half of the year. And you only pay 5% the cost of the drugs while you're in that catastrophic level. Okay. Once again, very few people on Medicare reach these steps 3 and 4. Only about 12% get to step 3, and only about 4% get all the way to step 4 for their catastrophic coverage. All right. So just to look at an example to help illustrate this a little bit more, and I know it's a bit of an eye chart here, so I'm going to kind of walk through this slide. But this is an example we look at year over year to see, well, what is the impact of these changes, right, to Part D of Medicare, right? We just looked at the initial coverage level change went up. The catastrophic true out-of-pocket also went up for 2023. These tend to go up each year. But what is the net impact to the consumer who's on those expensive medications? And we're going to see in this example, it's the net impact of these changes is roughly about $100 for the year. If you have expensive drugs, these changes result in roughly $100 extra out of pocket for the year. So this example is going to walk through that donut hole month by month and the catastrophic level as well. So if you have one medication, just for simplicity, the purpose of this Part D of Medicare is really based on the total cost of your medications, but just for simplicity, I'm using one medication for this example, and it's an expensive drug. It's something you see a commercial for. It has a retail cost of $1,200 a month. Okay, in this example, your copay with your drug plan happens to be $80 for this medication. Your plan does not have a deductible. Just for the simplicity, your drug plan does not have a deductible. The initial coverage level, again, is going to $46.60 in 2023. The discount for the pharmaceutical discount while you're in the donut hole is at 70%, right? So that's why you only pay the 25%, and then the plan pays the other 5%. Those numbers are important because, again, that's what factors into that true out-of-pocket number to determine when you're going to reach catastrophic coverage. And that true out-of-pocket limit, again, is $7,400 for 2023. So this slide just breaks down by month throughout the year, how much are you paying for that medication? So in this example, with all these assumptions, the first few months, you're just paying the $80 copay, right? You go to pick up your medication, it's $80 in January, February, and March. And then you get into April, and you go to pick up that same medication, and the pharmacist says that'll be $106. And it's confusing for a lot of people, right? Why, if it's the first time on Part D of Medicare, why did my cost change? And then it goes up even more in May. It goes up to $300 in May, June, July, all the way through October. What happens here? In April, what happens is you've reached the coverage gap, right? It doesn't mean you spent $4,660 on your drugs, but you've consumed more than $4,660, right? It's $1,200 a month retail. So first month, second month, third month. Now by the time you get to April, that $4,800 is over the $4,660. So now this is we'll call it a weighted month, right? So you're not fully in the coverage gap. You're paying sort of a blended rate between the copay and the coverage gap rate. And then each month after that, while you're in the coverage gap, you're paying that 25%, right? That's what you pay while you're in the coverage gap. So 25% of the $1,200 retail, you're paying $300 a month for that medication that used to cost you $80 a month, all right? However, you're not stuck in that for the entire rest of the year. In this example, because it's a very expensive medication, you're eventually going to reach what's called catastrophic coverage, where your costs drop back down again, and you're going to pay 5% the cost of the drug, which is $60. And November is a blended month because that's the month they're reaching catastrophic coverage, and so you're paying $97 for that drug. And the total for the year comes out to that $2303. To explain the catastrophic a little bit further, how do we get to there in November? Well, we looked at the retail cost to determine when we're going to reach the coverage gap, right? But we have to look at the true out-of-pocket cost to determine when we're going to reach the catastrophic level. So the true out-of-pocket, again, is everything you've spent for your medications, plus it includes that pharmaceutical discount for those drugs while you're in the coverage gap. That's that 70% discount, or roughly $840 a month for that drug while you're in the coverage gap. So that's going to factor in to this running total of the true, here it is, true out-of-pocket cost. So $80, because that's what you paid for your drug, then $160, $240. Now you're getting credit while you're in the donut hole for what you've spent, plus the pharmaceutical discount for those brand name drugs. So that $840 a month plus the $300 a month comes out to the $1140, right? And so that just keeps getting added in to that running true out-of-pocket cost. And then in the month of between October and November, you can see that $7,400 is going to be between there. So that's the month that you reach that catastrophic level, and you pay that, you're paying 5% basically once you get to catastrophic. All right, so I know that can be very confusing, and again, this only impacts about 12% of people reach that coverage gap, and about another 4% or so reach all the way to the catastrophic level. All right, so I hope that helps explain that a little bit for you. A couple other points just to mention. We get a lot of questions about these Part D drug plans and what are some other ways you could save on your medications. Each state has state assistance programs. In our home state, which is where our office is, New Jersey, there's a great program, New Jersey PAD, P-A-A-D, which is Prescription Assistance for the Aged and Disabled. There's also something called Senior Gold. This is all run through the state Medicaid offices, and they help with your Part D premiums as well as your drug costs if you're in a lower income bracket. And those income thresholds keep going up, so it's more and more people that are qualifying for those income assistance programs. And again, they have those in each state, so if you're having trouble paying for those expensive medications, that's a great thing to look into within your state Medicaid office if there's a prescription assistance type program available. Some other things that are out there, there's some discount programs out there on different websites like coupon websites for medications. Generally speaking, those are not going to be for the very expensive medications, but there are certain things like inhalers and creams and lotions that are prescribed that can be very expensive on the Part D drug plans, and for some reason you're getting better pricing on those coupon websites for those medications. So those are just a couple of other tips to be aware of to help you save money on your medication cost. As far as the Part D plans go, every year between October 15th and December 7th, that's your one opportunity each year to review your drug plan for the following year. Make sure you have the right drug plan for the following year. These drug plans do change every year, so even if your drug list does not change, you want to make sure you're taking advantage and reviewing the drug plans to make sure you have the right Part D coverage for the following year. We do remind all of our clients in September every year. We send out reminders to get their latest prescription information. This is the link we send out. It's a drug form to fill out. And then we complete that Part D analysis every year to make sure they have the right prescription plan for the following year. And lastly here, why work with senior advisors? Well, we show this slide kind of each year, but if you work with us, you probably have a big smile on your face, like my daughter did here. And if you don't work with senior advisors, you might not be too happy there, like my son in that picture. Lastly, we do have a few other resources available. We highly recommend you subscribe to us on YouTube. That's where our latest updates come out. Follow us on Facebook. We've got a bunch of information on our website. We have a 90-minute workshop video if you want to watch just a Medicare 101, and a lot of other great stuff out there. So I hope you found this video helpful, and if you have any questions, you can reach out to us at the numbers you see below. Thanks, and have a great day.